Alrighty, we're going to go ahead and get started. So thanks to everyone who is spending their evening with us. I'm really excited for this class tonight. I love talking about everything pelvic health related. And I was ecstatic when I asked Dahlia to collaborate with me for this class to talk about pelvic health and gut health, because those two go hand in hand. And we're really lucky to have her, and I'll have her introduce herself in just a little bit. But just to introduce myself, for those of you who don't know who I am, my name is Wong. I'm one of the physical therapists here at IPA Physio. I treat both general orthopedic as well as pelvic health conditions. I think I became interested in pelvic health when I started PT school. And I think just learning more about the material and meeting more people who were having issues with their pelvis or having some of these symptoms that we're going to talk about tonight, I just realized that there's such a lack of education, there's such a lack of resources for this patient population, and I wanted to be a part of that. So I am very passionate about providing education to people who might be suffering with some of these diagnoses or these symptoms. And yeah, so I love talking about that. I love to focus on the whole body with my functional manual therapy background. I'm not just focusing on the pelvis, but treating the whole body as it is, since we're not functioning as just a pelvis, but with the whole body. And I'll have Dahlia go ahead and introduce herself.
Hi, everyone. Nice to meet you all. If you are new faces to me, I am Dahlia Marin. I'm a registered dietitian, nutritionist, quite a mouthful, and a licensed dietitian. I am extremely passionate about nutrition and really incorporating nutrition as a key foundational aspect of improving lifestyle. And I have used food. I truly believe that food can be medicine, so much so that one of our trademarks is heal with each meal. And I truly believe that we can do that. I've worked with thousands of patients. I've been both a nutritionist, then a dietitian, because they are two different things. But I've been in this space and been in the field for over a decade. And I have helped people along their journeys with several different things. And I've helped myself. I always say I was my own first patient, and I helped myself first and foremost overcome quite a bit. I lost and kept off 50 pounds and shed with that prediabetes, polycystic ovarian syndrome, GI issues. Hashimoto's is an autoimmune thyroid condition that I live with, which is much now better controlled now that my diet is really on point in my lifestyle. And yeah, I'm really extremely passionate about gut health. I truly feel that gut health really encompasses all health, and that all signs point to the gut when things are going awry. So many factors really are entwined in gut health. We'll get into several of them today, but I love, love, love helping people figure out the why of their symptoms and really start to thrive and understand their health a little bit better and figure out their root cause. And I am part of a larger practice. I am the co-founder, along with my husband, James, who's also a dietitian, of Married to Health. And we are an integrative dietetics practice. All of our practitioners are highly educated. We all are very passionate about introducing and incorporating integrative and holistic. And I don't say holistic with an H, I say it with a W, because we really try to encompass whole person care, right? And really try to intertwine both Western modalities, Eastern modalities, and really help a patient understand whether it's past triggers, past traumas, their diet, their sleep cycle, their stress, their movement. We really try to help patients encompass that. We try to help them understand, hey, it might be best for you to pull in someone else. It might be best for you to pull in a physical therapist or someone to support you with mental health. So our whole team is really passionate about that.
So how the two professions and healthcare providers can work together. I think both providers, we both strive to collaborate and really focus on patient-centered care. I think for both Dahlia and I, through my interactions with Dahlia, just to notice like how much each team really cares about their patients, and our treatments are really directed to be centered around you as a person and an individual. And like Dahlia mentioned, each specialty goes through, our own personal experience, educational training, and all the things that we've listed here. Both of our goals are to provide education to patients on improving quality of life, whether that's through mobility, reduction of inflammation, which is a big thing that we're going to be talking about tonight, and then just understanding how different systems in our body really work together, and how if they're not functioning as they should, they can hinder how the others are working. So this is just a quick class overview of what we'll be talking tonight. It's quite a bit. So if you happen to have any questions, we just ask that you save them at the end, and we'll provide some time for anyone to ask any questions that they might have. So for those of you who are new to pelvic floor or pelvic floor physical therapy, you might ask, like, why is this muscle important? We have 5 specific functions of our pelvic floor, as I've listed here. The first one being support. We have a lot of organs that sit in our abdomen and in our pelvis. And our pelvic floor muscles are there, as you can see in the picture. They are attached all along the pelvis, almost like a hammock. So they prevent any organs from falling out of our pelvis. And this could be with any activities of daily living, or if we increase our abdominal pressure with sneezing or coughing or anything like that. They also are a part of our core muscles, which is where the stability aspect comes in. So they have to be able to work in opposition with our diaphragm to provide an environment where we can automatically engage our abdominals. They also act as a sphincter. So like I mentioned before, whenever we increase our intra-abdominal pressure, whether that's through coughing, sneezing, laughing, those need to be able to contract to prevent any urinary or fecal leakage from occurring. They also need to be able to relax to allow us to void and urinate, as well as have comfortable bowel movements. Our pelvic floor muscles are also absolutely necessary and so important for sexual performance. So they help to achieve and sustain an erection, and they're also necessary for an orgasm to occur. And then they also need to be able to help pump blood and lymph through our system. And this can help decrease any swelling or pelvic congestion that's occurring in the area. So inflammation is a big thing that we're going to be talking tonight about. And so, oftentimes we ask, why is inflammation important? What is it exactly? This is our body's response to preventing the spread of infection, control any damage that has occurred to the tissues, remove dead tissues, and then it attracts the necessary tissues or cells, I should say, to the damaged area to help heal and get that healing process started. So inflammation is not necessarily a bad thing. When it becomes, something that we don't want to happen is when it lingers, and this can affect our body's pain response. So which is why I think we emphasize so much, creating an environment where our body can actually heal when we have some sort of injury occur. So when we have inflammatory pain, this can increase the intensity that we experience pain. This can increase the frequency, the duration that we also experience pain. So as you can imagine, like with this increase in our pain experience, this is going to affect our body's ability to heal and recover from some sort of pain that we might be experiencing. And then in this picture, we've got just different diseases that we typically see that are linked to chronic inflammation. And I always tell my patients, our goal is to create an environment for your body to heal. And that's so important. That's why a lot of us here at IP Physio talk so much about the things listed on this page. Day one, we're asking about, what's your activity level like? Do you tend to be a little bit more sedentary? Are you staying active? Are you getting movement throughout the day? Environmental exposures are so huge because that's something that we don't typically think about. Things like pesticides, are we having mold exposure, whether that's in our house and we might not even know it? Personal care products are huge. There's so many chemicals that are in a lot of the things that we put on our body that could be increasing our levels of inflammation without us knowing. And then home products, cleaning agents, things like that. We talk a lot about sleep. We always ask about sleep position, how many hours of sleep you're getting, what's the quality of sleep that you're getting, because if our body isn't getting the sleep and rest that it needs, we're prone to experience pain at a higher level. So that's super important for us. We always ask about stress level. This is also going to play a role in how our bodies are able to deal with pain and heal. Alcohol and drug abuse, and then screen time, and then even just things like getting out in the sunlight and getting natural sunlight and getting adequate vitamin D levels. So important for our bodies.
Yes. I love that, because a lot of the times my patients come to me and they're like, it must be the apples that I'm eating, or it must be the beans that I'm eating. And oftentimes when we do go through those lifestyle factors and these lifestyle triggers, and I'm inquiring, how's your sleep? Oh, I don't sleep. And, how's your stress level? I'm extremely stressed. I don't go in the sun. I'm inside all the time and I drink alcohol every day. We want to really ensure that that foundational portion is really, really solid. And then let's start trying to understand how your diet is possibly affecting, exacerbating, or reducing inflammation. And, diet really can make an impact. Although I have patients come and tell me all the time, like, oh, my doctor told me that what I eat has nothing to do with how I feel. I'm not hating on doctors, love doctors, work with them all the time. But there really is a common misconception out there that what we eat does not matter to how we feel. And there are even, specialists in the GI tract who might make this claim, and it's still out there. It's pretty antiquated, but, you're still hearing it. What we eat can certainly impact our inflammation directly. It literally is a substance that's coming into contact with so many different parts of our immune system on a daily basis. And our immune system, I think most of us think, is just in our blood. We think, okay, I get an infection, my immune system activates, I have a little fever, my immune system is trying to clear that out. Yes, we do have our immune system in our blood, and we also have immune system in our mucous membranes, and we also have immune system laying right outside of our epithelial lining, our gut lining. So there are many parts of our immune system. So what we put on in around our bodies really does matter, and food is one of those things that's constantly coming directly into contact with that layer of mucus, with our gut lining, with our entire gastrointestinal tract. Everything from your mouth to your anus, it's all connected. So when food is making its way through that tract, it certainly can either drive up inflammation or kind of dampen inflammation and put a little bit of that fire out. I like to think of inflammation as a little fire. I like to give that visual. A little bit of fire is good, right? We can cook on it. We can roast things on it. We can stay cozy by a warm fire. But you don't want to put too much fuel on your fire because things will start to burn. So that little bit of inflammation is great. We generate a little bit of inflammation when we exercise, when our body temperature warms up. We can generate a tiny bit of inflammation after eating, but it's really that balance of how much fuel you're adding to that fire. And we know that inflammation, as Kat mentioned, is associated with that stress. So stress can be anything. It can be physical, like physical pain, which, that can involve diet at times. It can be chemical, as Kat mentioned, and it can be mental and emotional. So any of those types of stress might drive up your blood sugar. Food can drive up blood sugar. Stress can drive up blood sugar. Environmental toxins can drive up blood sugar. When our cholesterol is high, our body is generally feeling stress. There's a larger load to bear. So this stress can be coming from anywhere in the body, but that can certainly drive up inflammation. And foods, and we'll get into it in just a second, certain foods can either increase inflammation or help us dampen and decrease inflammation, as I had mentioned. So what are just very, very large umbrella tips to reducing inflammation, at least in your gut? We'll start there and then we'll kind of branch out. But you really want to focus on consuming an abundance of fiber rather. And so I always get this question of, well, what about lectins, right? Should I avoid beans? It must be these beans that I'm eating, or it must be the tomatoes. And I always like to say, there aren't really gassy foods. There are gassy people. So if you find you're not tolerating lectins, which you certainly might not be, we want to say why. Instead of removing things and staying on these prolonged elimination diets, we want to try to work your way back up and get you to a place where you can consume and tolerate an abundance of fiber. We know that the USDA recommends at least 25 to 30 grams of fiber per day, and only about 2% of Americans, 2 to 3%, get that in. And 25 to 30 grams is not much, honestly. So for only a very small percentage of us to be getting that in makes me question, what else are we getting in if it's not an abundance of different types of fiber? And so if you're hearing this and you're like, oh my gosh, I need to suddenly eat 60 grams of fiber, please don't go from 5 to 60 in one day, because you will be messaging me saying, I can't stand you, I'm super bloated. So you really want to slowly ease your way into that. And we'll talk about how to do that. And in that, as you're eating more fiber, you want to try to eat a rainbow of colors. We know each different color contains different antioxidants. Think of antioxidants as fire extinguishers. So again, a little bit of fire is good, but when it gets out of control, we want to have those fire extinguishers readily available. Different colors provide those different antioxidants and phytonutrients. And this can be very, very helpful for managing inflammation. So you want to eat that rainbow of colors. You want to regularly consume omega-3 fatty acids. Preferably, you're getting them well balanced in your diet. This can come from different things like sea vegetables. We know seaweed, algae, that can be a wonderful source of omega-3s. Nuts and seeds are as well. We know certain oils like extra virgin olive oil can contain higher amounts of omega-3, certain types of seafood. So you want to regularly consume omega-3 in your diet. And if you recognize you're not doing that, you might consider supplementing it after you speak with your care team. And then another just umbrella concept in reducing inflammation in your gut through diet is hydrate sufficiently. So many of us walk around dehydrated. If you're not getting in at least half of your body weight in ounces per day, you are very likely underhydrating yourself. So that also can be very, very instrumental to a healthy gut. All right. So what are some of these types of foods that are fuel to this fire that we generally have going through our bodies? So refined carbohydrates are extremely prevalent, and we know that these can be high in many people's diets. I oftentimes have patients come to me and tell me how amazing they feel after going gluten-free. They might have celiac disease and feel that improvement. They might have non-celiac gluten sensitivity, or they might have had a highly processed diet, and they might not be sensitive to gluten at all. And gluten is a protein that's found in wheat, barley, and rye. They might not have been sensitive at all, but they might have been consuming excessive amounts of highly refined wheat. And so now that they're not eating those refined carbohydrates, they're feeling better. Their inflammation has decreased. So refined grains are one type of refined carbohydrate. We also see refined sugars. Most sugar once was a whole plant, and we've refined it down to a place where it is highly concentrated, meaning it's going to be very potent, and you're likely to have exacerbated and really extreme kind of responses to it. So you're not going to respond the same to eating a piece of corn as you would to having something with high fructose corn syrup in it, right? Once upon a time ago, high fructose corn syrup was corn. So the more you refine it, you remove fiber, you're removing some of that healthier starch, it's going to have a more exaggerated response. So that refined sugar, refined grains, alcohol. So you want to really assess, how often am I having alcohol? Again, this is coming from, yes, fermentation, but also refinement. So most alcohol is coming from plants, yes, but when we're highly refining those properties, it can be inflammatory. Saturated fats can be another source of inflammation. So saturated fats that are found in high fat animal products. We know things like red meat, lamb, fatty cuts of other meats, fermented meats like deli meats and sausages, things like that. And even in plant foods, things that have large amounts of coconut oil or palm oil are high in saturated fat. And this type of fat has been shown in studies to induce leaky gut, right? That intestinal hyperpermeability. You don't want leaky gut. You want an intact gut, because if there is any fire in that gut, you don't want it spreading out of the gut into the rest of your body. So you don't want to constantly be consuming things that are adding fuel to that fire. So those things that I had mentioned certainly can. And there also have been some studies that link high animal protein intake to increased inflammation in the gut. And then other things outside of these just kind of umbrella general inflammatory foods. We sometimes see that, again, with a damaged gut, where maybe that protective layer of beautiful mucus that we have lining our entire gastrointestinal tract. So our esophagus, our stomach, our small intestine, our large intestine, maybe that layer of protective mucus has been damaged, starved of fiber. Maybe we are having leaky gut, intestinal hyperpermeability. And so now we might have an imbalance of who is living inside of our gut. So that dysbiosis that we're hearing more about is really that imbalance. You might have now more inflammatory species that are residing inside of your gut. They've really moved in, they've taken over the neighborhood. And now you're finding that certain helpful strains, anti-inflammatory or commensal strains of microbes, bacteria, viruses, fungus, other microbes, they're not able to do their thing. And some of these things can be breaking down compounds of foods that are harder to break down. So it might be oxalates, it might be lectins, it might be salicylates, it might be gluten and other larger proteins in certain foods. You might now have more food allergies and food sensitivities. And it's not necessarily the food, it's the damaged gut. So the goal should not be to remove all these different foods. It should be to repair the gut lining, really bring back that protective mucus layer so you are tolerating all of these things. More and more people are starting to see that they're developing histamine intolerance. And histamines are they're a natural part of our environment. We know that in certain seasons, there's a higher amount of histamine in the air from certain plants blooming. We eat histamines in certain foods, and we naturally release histamines. Whenever we're stressed or even excited and we release adrenaline, we release histamine with it, which usually is fine. We have a compound in our body called DAO, diamine oxidase. It breaks down histamines. And guess what? 60% of it is made in your intestinal lining of your small intestine. If that's damaged and you have leaky gut now, you're reducing your capacity to break down some of these histamines. So again, I always want to say, let's not blame the food. Let's work on healing our gut so you're tolerating the food a lot better. All right, perfect. So when you're not tolerating these foods, it certainly can lead to symptoms. We're going to focus today on gut-derived symptoms, so things like bloating, constipation, change in bowel habits, but you certainly can feel other symptoms of inflammation elsewhere. We're just not going to touch on them today. Maybe we'll do another class, but you might be feeling in other parts of your body things like joint pain. You might be feeling brain fog and fatigue. You might have postnasal drip that's chronic. So you might constantly be clearing your throat, or you might constantly have a runny nose. So these can be other symptoms of inflammation elsewhere. And in the gut, you might have bloating and or distension. So let's differentiate the two. Bloating is the sensation of abdominal swelling. And I say the sensation of swelling because oftentimes patients might say that they feel extremely bloated. For example, some of my patients with IBS, irritable bowel syndrome, or small intestinal bacterial overgrowth, they will say, I feel 9 months pregnant. And they'll show me pictures and they might not look that bloated to that extreme, but they feel very bloated. So they might have that visceral hypersensitivity, those very sensitive nerves. So any amount of bloating or any amount of distension might be very bothersome to those nerves that are very sensitive in and around the gut. And distension rather refers to the actual increase in measured abdominal size. And sometimes I'll recommend that to my patient. I will say, let's figure out just how distended you are becoming throughout the day so we can see, is there actual gas production, or is it more of a feeling of discomfort? Is that feeling of bloating? So maybe we'll do a waist circumference measurement in the morning versus the evening, and we'll kind of see how distended are you. And, we sometimes see different types of bloat. So we might see bloat at certain times of the month. We know hormones can certainly drive bloat or decrease bloat. You might feel a little bit more bloated when you're closer to menstruation because you're experiencing a drop in progesterone and a drop in that estrogen. Usually when you are ovulating, you're like, oh, wow, I feel really trim and I feel really amazing when those hormones are higher. Oftentimes when women are in perimenopause or in menopause, they feel like they are more bloated and they are more distended on a regular basis. So those hormonal changes can factor into that. Your bloat might be cumulative and it might happen throughout the entire day. This can be normal, right? When we are eating food, we are putting more substance into our body. And if it's fibrous food, it does require a little bit of fermentation as it's breaking down. So a little bit of bloat can be normal. But if you feel like it's exaggerated bloat, if you feel like you're abnormally gassy, perhaps you're passing irregular amounts of gas, abnormal amounts of gas, more than 15 to 20 times per day, that's maybe a question mark to note and discuss with your care team. If you feel like your gas is cumulative throughout the day and you say, once I start eating or drinking, I start feeling more and more and more bloated. It doesn't dissipate between meals. It just accumulates on top of each other. And by the end of the day, I'm so bloated, so uncomfortable. It's hard to handle. I unbutton my pants. I'm changing my clothes. Some of my patients will tell me that. So if that's the case, that's not necessarily normal amount of bloat. If my patients are telling me that along with their bloat, they have this very malodorous gas that might smell like sulfur or rotten eggs, not necessarily a normal thing. And again, when it's very painful, making them feel like they're crouched in the fetal position or their clothes are uncomfortable, that can be abnormal distension, abnormal sensation of bloating. And then some might say, it doesn't matter what I eat, it doesn't matter what I do, I wake with bloat. So those things are very interesting to explore. You want to try to identify, are you having constipation? And is it lingering? Are you chronically constipated where you might have your morning bowel movement and you might still feel bloated? You might still actually be constipated. Just because you had a bowel movement, it doesn't mean you completely evacuated your bowels. So is it constipation bloat? Is it kind of hangover bloat from that leftover constipation? Is it slow motility or movement where, again, that might factor into the constipation? Things are not making their way out of your body at an appropriate pace. Is it that imbalance of microbes? Do you have a higher propensity to having more inflammatory microbes living in your gut? That might cause bloat in the morning. Or you might have histamine intolerance and you just feel bloated all the time. Bloat can certainly also happen with inflammatory bowel disease, which we'll talk about a little bit. But before we get there, I mentioned constipation. And so with constipation, Kat and I both see this, and Kat will, come in at the end of this one, but I always want to kind of help people understand their stool, right? What's your poo telling you? I love that book. Of course I have it. I have like 2 copies of it, but I love sharing this stool chart. And every time I see my patients, they see this chart every visit because it can be very valuable. I always want to understand, what types of stool are you having? And it shocks me when people say they don't know because they don't look. I mean, TMI, but I'm always looking, and I'll get out like a flashlight and I'm like, is there any undigested food in there? What's going on there? Because it can be so valuable to understand, what is your body doing with this fuel that you're putting into it? Is it generating inflammation? Is there existing inflammation? So with your stool, you want to kind of take a look at it, right? If you haven't been looking, I encourage you to start looking, and you want to look for consistency. So on this chart, you're seeing types 1 through 7. You're aiming for a type 3, 4, or 5. And 4 really is like gold standard poop, right? So you really want to be seeing these beautiful, smooth sausage or snake-like bowel habits, bowel movements. But 3s and 5s are also fine. And so people always ask me, how frequently should I be having a bowel movement? Ideally, gold standard is once a day, but normal is considered normal, anywhere from 3 a week. I can't imagine that. That seems like it would be very uncomfortable. To 3 a day is considered normal, but at least once a day is what I try to encourage for my patients. Most people are going in the morning, and that is because overnight we're really kind of concentrating, packaging up, digesting, cleaning up our entire system. And we've had that chance to really package up a nice, beautiful stool. And our colon has expanded. And when our colon is expanded, it sends these signals to our brain and it tells our brain time to release, time to evacuate. You might not feel hungry in the morning before you've had your stool and your bowel movement because of that signaling, that gastrocolic reflex. So most people go in the morning, but not everyone goes in the morning. There's no right or wrong time as long as you're able to go when you need to go. And then, with timing as well, as long as you're not going 5, 6, 7, 8 times a day, it's usually pretty fine. With color, you want to see varying shades of brown, different colors like black, very dark green, yellow, red stool, white stool. That's kind of cause for concern. If your stools are consistently those different colors, you might want to link up with your care team. And then the size. So the larger generally and easier to pass, the better. You want them to be generally the size of more than 2 eggs because that has been shown in studies to reduce risk of colon cancer. And with that as well, you want to make sure that you're not seeing any mucus. And my patients always ask, well, how do I know if it's mucus? It almost looks like discharge. It almost looks like boogers, right? If you were sick and you had blown your nose, you'll see mucus. Sometimes the mucus is enveloping the stool and sometimes it's kind of just floating in the toilet bowl. It might be there when you're wiping. So if you're seeing consistent mucus, bring that up to your care team. If you're seeing blood, bring that up to your care team, especially if you can tell it's not coming from a hemorrhoid, but just to be safe, you want to bring it up anyways. And you're not seeing consistent undigested food in your stool. If you're consistently saying like, oh, there are those carrots and mushrooms that I ate, again, that's something to kind of explore a little bit more because that means you might not be digesting very well. And sometimes my patients say, I'm not constipated. I'm having these looser type 5, 6, or 7s. That does not necessarily mean you're not constipated. I can't even tell you how many times we've found that people think that they have diarrhea and constipation alternating, and it's mostly constipation. They're having overflow diarrhea where they get so backed up, your body's so desperate, it draws a bunch of water into the colon to just wash it out. And then you end up having diarrhea. And then you might have constipation for a few days. So keep an eye on that. What is your pattern with that? And then outside of these looser stools, which can also mean inflammation, lack of fiber, you might have these kind of dry or hard type 1, 2, and sometimes type 3 stools where they're very dry, they're cracked, they're lumpy, they're hard to pass. So that can be an indication of dehydration. So ensuring that you're drinking enough and eating enough hydrating foods. Hydrating foods can hydrate your stool in a different way than water can, because not all water that we drink directly makes its way into the bowels. So you want to eat water-rich foods too. You want to eat an abundance of both soluble and insoluble fiber. And I like to kind of describe that insoluble fiber is like a broom. And it doesn't drink up water, right? When we're cleaning our floors, we're not wetting our broom first. So insoluble fiber doesn't necessarily drink up water. It acts like a broom. It pushes things through. Then we need to mop afterwards. So we have this beautiful soluble fiber. So it mops up any leftover spots and really helps lubricate and move things through. You want to be getting in both. So if you're having those dry or hard lumpy stools, might be a lack of fiber, might be dehydration. And Kat's going to tell us more in a minute about pelvic floor dysfunction and how that can factor in. Anytime someone's telling me they have a type 1, I tell them to go see Kat to make sure that they're not having pelvic floor dysfunction. So yeah, and then again, with those looser stools, like I mentioned, dysbiosis, higher amounts of inflammation in the intestines. It can mean infection. It can also mean inflammation in the gut, like inflammatory bowel disease or other types of inflammation.
In regards to things that pelvic floor PT can address, in addition, we can talk about some fiber intake, water intake, and whatnot. But one of the things that I do talk with people is pooping posture. So addressing this anorectal angle, and I have a picture here to just kind of show, just in terms of like different sitting postures and what that does to the rectum and your puborectalis muscle, which is one of your pelvic floor muscles. So in this part, if you're sitting in more like an upright 90-degree position, hips are in line with knees and whatnot, that puborectalis muscle is actually pulling on that rectum. And so that causes a kink. Imagine like a hose, like if there's like that hose is twisted, it's really hard for water to come out. And so if we either, put something underneath our feet, so knees are a little bit higher than hips, or if we lean our trunks forward, we can rest our elbows on our knees. That slackens that puborectalis muscle and allows for that rectum to have just an easier way for that stool to move through. So things like that. We can also talk about the importance of just our breathing. We talk a lot about chest breathing versus diaphragmatic breathing. Diaphragmatic breathing is one of the best ways to keep normal motility, because as we're expanding through our diaphragm and our belly, our lower rib cage and our lower back, that is allowing for motility to occur through the colon, and just our general visceral health. A lot of times when people breathe through their chest, they're really not expanding well through their bellies and their lower trunk, and we create a holding pattern, which can cause tension in the belly, tension in the back, and that can cause a lot of issues for the GI tract. So just emphasizing, we can work whether there's soft tissue restrictions through the diaphragm, through the rib cage, through the abdomen, working through restrictions through there. My tip for people who tend to strain when they're constipated, so we're holding our breath and we're like actively pushing down, almost like a Valsalva maneuver. I typically tell people, our abdominals are super important to aid in that mobility through stool, through the system. And so working on breathing through our belly. So I tell people the cues, belly big and belly hard. So breathing to create an expansion through our stomach, through our diaphragm, so belly big. And then when we exhale, you're going to tighten, you're going to act as if someone's trying to punch you in the gut. So belly hard. And so that facilitation of those abdominal muscles help without straining and holding our breath, which then increases intra-abdominal pressure for a stool to move easier through the system. A lot of times if we're straining, this can cause other issues down the road. So this can cause prolapse. This can cause anal fissures to occur or hemorrhoids. So we don't want those things. So breathing is super important when it comes to our bowel movements. And then pelvic floor muscles specifically, they need to be able to relax and slacken to allow stool to move through the rectum comfortably. So sometimes our muscles might be in spasm, or sometimes we might actually be contracting our muscles instead of allowing them to relax, which is what we call a paradoxical contraction. And oftentimes we don't even realize that we're contracting those muscles instead of relaxing them, which is where, when you come to see me, we can work on different ways to work through those muscles. So that could be working around the pelvis, making sure that you have appropriate mobility to get into positions for comfortable sitting posture when you're going to the bathroom. Working internally with the pelvic floor muscles to work soft tissue tension or things like that around your puborectalis, internal, external anal sphincter muscles. Those are so important in needing to be able to relax to allow that stool to move through the system. We can also talk about creating a routine. That is so important for having normal and regular bowel movements. So that could be something like, having a warm beverage, whether in the morning or when you wake up in the morning, have some sort of beverage that's warm, whether it's coffee, tea, hot water. teaching things like a bowel massage, and that's just a gentle massage around the colon to create, again, stimulate movement through the colon. Working through stretches, a lot of rotational stretches help facilitate movement through the colon as well. And then if there are things like, some people might have slower motility, sometimes, coffee, caffeine can help stimulate that movement. In terms of teas, there are things like the Smooth Move tea brand that can help stimulate movement through the colon. And then things like prune juice with pulp can also help in terms of motility.
I love that. Those were such great tips. And I have had so many patients say that pelvic floor therapy was a game changer, especially when they were having fecal leakage or they were having those type 1 or type 2 stools when they really were bearing down. And I don't know about you guys, but I was like really practicing what Kat was saying. And I was like, oh, belly bag. Okay, belly. So practicing these things every day can be very, very helpful. And in addition to some of the things that Kat mentioned, you can always try magnesium as well. I'm a big fan of using magnesium at night before bed to help really facilitate that relaxation of those muscles. So that way in the morning, hopefully you're ready to have a bowel movement. And I do recommend some of these things. Like we know warm beverages, they can relax the nerves a little bit. Certain stimulants like Cape Aloe or Senna can be habit forming. So you always want to kind of be aware of, am I using things that are habit forming that might cause me to have lazy colon? And it really is a Band-Aid where I'm having a bowel movement today, but down the road, I'm really training my colon on how to be very dependent on some of these stimulants. So if it's a stimulant laxative, you want to be mindful and say, okay, why do I need to use this? At its roots, what is going on? Is it my pelvic floor? Is it diet? Is it both? How can I enhance these two things? All right, perfect. And of course, we have seen that constipation can be one of the types of IBS. And most of us have heard of IBS. I had mentioned it prior where IBS is irritable bowel syndrome. And again, it's a syndrome. They're now classifying it as a disease where it's a collection of different symptoms. There's criteria that is used to diagnose IBS. And it's basically to say that you've had abdominal pain or changes in bowels, whether it's bowel frequency, bowel form, bowel, just change in bowels at least 1 day per week for 3+ months. And ideally, patients are having this for 3 to 6 months prior to diagnosis, but that's pretty nonspecific, right? Most of us have one stomach ache or one different bowel in a week. So, but if it's consistent, it's happening every single week for 3 months, that might qualify you for an IBS diagnosis, which again is more of an umbrella term. It doesn't necessarily tell you what's going on, but there are different classes of IBS. So you might get diagnosed with IBS-D, where it's diarrhea predominant. It might be IBS-C, where it's constipation prominent. It might be M, where it's mixed. You might have alternating diarrhea and constipation, or it might be unspecified, unclassified, where maybe you don't really fall into any of these specific categories, but you are having this pain, you're having this discomfort, you're having change in stool. So one of the prevalent type of IBS is small intestinal bacterial overgrowth or intestinal methanogenic overgrowth or small intestinal fungal overgrowth. So it could be SIBO, IMO, SIFO. These are subtypes of IBS, and they're not necessarily a root cause, but it's a little bit more specific than telling someone you have IBS. I don't know why. So it's a little bit digging in a little bit deeper. You want to help a patient rule out, do you have some type of overgrowth of whatever, if it's fungus, if it's bacteria, if it's methane, and it might be driving some of these symptoms. And then once you've identified that, try to help the patient identify why they have those overgrowths, why they have that imbalance. So again, typical symptoms are going to be abdominal pain, constipation, diarrhea, or alternating constipation, diarrhea. You want to get to the root cause. So see lifestyle contributors that might be contributing to dysmotility or dysbiosis. You, again, want to see what else in my environment that's going in, on, around my body is factoring into this. And you might consider bringing on a dietitian to your team. A gastroenterologist likely is the one probably providing this diagnosis. Your primary care provider can provide a diagnosis of IBS, and you very well may be seeing a pelvic floor physical therapist. And Kat and I really do share care on patients who have been diagnosed with IBS because they want to figure out why.
So in regards to pelvic floor PT with IBS and SIBO type diagnoses, a lot of the things that we can work on in physical therapy, just in terms of posture, especially if someone tends to be a little bit more like crouched down, their rib cage is really kind of compressed down towards their pelvis. This is going to cause a lot of tension through the abdomen, which can then, increase and irritate symptoms that are already there. So working through things like posture and all that encompasses, whether that's working through restrictions that someone might have, working through breathing again. One thing that I do want to touch on specifically is I wrote intraoral on there. So some things that I found with this patient population, if there are any nutrient deficiencies, we are looking at, that could be something from like someone's lack of ability to appropriately chew their food. So if that is not happening, whether history of a cleft palate or a narrow palate, those things are going to be super important. If we're not able to chew our food and digest well, we're not going to get the nutrients that we need to absorb into the gut. So that's when your physical therapist can come in and work actually in your mouth to work on expansion through there, as well as other areas through this area to work on that. Because that is so important. That's not something that's really looked at oftentimes. But this can also play a huge role in the symptoms that we experience with these types of diagnoses. And then again, with visceral abdominal mobilization. So, that your colon is, if that's so bound down from years of just, cramping or pain or different things like that, working through to create an environment in your abdomen where your organs can move as they should.
We do really see that. So whether it's from somebody who's had undiagnosed or maybe uncontrolled inflammatory bowel disease, or somebody who's had IBS for quite some time, right? And they're constantly holding and really bearing down to hold in gas or hold in stool, we see that this might cause pelvic floor dysfunction as a result. So it's super important to really identify what is causing this? How can I get to the root of it? Because just continuing to use Miralax and laxatives is not necessarily going to help you feel better. It's just going to help symptoms temporarily. So if it's ongoing, it's not resolving, it might be something to look at.
So for interstitial cystitis or IC, this condition is it's a chronic condition causing bladder pressure, bladder pain, and sometimes pelvic pain as well. It's, symptoms can range from mild discomfort to pretty significant pain. This can present as inflammation or irritated bladder walls, which causes scarring and stiffening of the bladder. Causes are typically unknown. Typical signs and symptoms of IC could be pain in your pelvis or between the vagina and anus in women, or in men between the scrotum and anus. So this could look like a constant needing to go to the bathroom. So frequent urination, oftentimes small amounts of urination throughout the day and at night. And this can often happen like up to 60 times a day. So it's quite frequent for some people. And oftentimes there is pain or discomfort associated when the bladder is full. And then a noticeable relief after emptying the bladder. So that could be, different strategies in terms of pelvic floor that I might give someone who's coming in to see me who just reports, I have urinary frequency, I'm running to the bathroom constantly. For someone who has IC, I might not tell them, try to like lengthen out their void times, because if that's something that's causing them increased discomfort to do that, then that treatment's going to look different for someone who has IC. Someone with IC might also report pain with intercourse. IC can also resemble those symptoms like a chronic UTI. However, there's typically no infection present. Symptoms can worsen if someone with IC does get a UTI though. And then risk factors, typically we see women are diagnosed with IC more often than men. And symptoms in men can mimic IC, but they're often associated, and we'll talk more in a little bit about prostate glands or inflammation of prostate or prostatitis. Most people who are diagnosed with IC are typically in their 30s or older. And then it's also highly associated with someone who also has some sort of chronic pain disorder, such as IBS or fibromyalgia. And then again, I've listed here, a lot of times I will look at, I will take a look at what's going on at the pelvis, mobility-wise, pelvic floor, visceral. Pudendal nerve is something that I listed on here. Your pudendal nerve innervates a lot of areas in the pelvis. And this is something that we can address through pelvic floor physical therapy, if that is something that is playing a role in your IC.
And we know diet can be a large driver as well. And I love how Kat mentioned that oftentimes it's misdiagnosed for quite some time as a UTI, a urinary tract infection. And patients will say, well, I keep going to the doctor, my urine is clear, but they told me to just take back antibiotics anyways. And again, not hating on doctors, but sometimes that might exacerbate the issue. We know that in addition to diet playing a role in reducing the inflammation that's often seen with interstitial cystitis, that there's usually dysbiosis going on. We have seen that the gut microbiome has been altered with there more inflammatory microbes, less anti-inflammatory microbes living in the gut. And keep in mind, you don't just have a gut microbiome. You have a skin microbiome, you have a kidney microbiome, you have a prostate microbiome, you also have a bladder microbiome, you have a urinary microbiota. And so that dysbiosis can make its way into there. Studies have shown that interstitial cystitis patients generally lack Lactobacillus acidophilus strains. So if you are experiencing that dysbiosis and then you keep getting antibiotics, that's almost going to make it worse. Antibiotics wipe out bacteria, whether it is pathogenic or inflammatory bacteria or commensal or anti-inflammatory bacteria. And we know that if there's a lack already of one of these strains, then that can only exacerbate the issue. So we know that can be helpful in kind of getting a diagnosis, understanding when it's not normal, asking, if I don't have bacteria in my urine, why should I take an antibiotic? Is there anything else that you can suggest prior to me treating something that's not presenting itself? So with keeping IBS in mind, we have seen a link. Studies show that 40 to 60% of patients with interstitial cystitis also have been diagnosed with IBS. So that dysbiosis really does play a role into it. And oftentimes SIBO is very prevalent. So we've seen a rise in diagnoses of both small intestinal bacterial overgrowth, which is really dysbiosis or dysmotility, movement in the microbiome that might be kind of off. And really that balance. So we're seeing that there's a link between the two. And oftentimes when one flares, if someone's in a gut flare, they're also in an IC flare a lot of the time. So helping control the two can be helpful. Oftentimes because there is dysbiosis in the bladder, the pH is off in the bladder and acidic foods will be a little bit exacerbating. So patients with IC oftentimes will tell me, I don't tolerate citrus, I don't tolerate vinegars, tomato, anything that might temporarily alter the pH of the urine or even the pH of the gut. And the pH of the urine is a little bit more sensitive. So really understanding triggers. Soy can be a trigger for many people with IC, but oftentimes once the IBS is controlled, the gut is healed, the IC is a little bit better controlled, whether that again is bacterial overgrowth or a lack of bacteria. We have seen that there have been links between hydrogen sulfide and those sulfur producing microbes, those sulfur producing bacteria, or lack of sulfur reducers and those that break down sulfur. So it might be a nutrient deficiency, or again, it might be dysbiosis, but we have seen a high prevalence of hydrogen sulfide gas in those who have interstitial cystitis. So again, if you're that person at home saying, wow, That's me. I keep getting diagnosed with UTIs, although my urine is clear. I have that sulfury smelling gas. I have IBS. This might be something to think about and bring up with your care team. All right. And the other kind of side of the coin is IBD. And we know that those with IBD can also have IBS. They are different. So IBS, again, irritable bowel syndrome. IBD is inflammatory bowel disease. So that is an umbrella term of several different types of inflammatory diseases that can be in different areas of the gastrointestinal tract. So can be in the small intestine, the large intestine, it might be localized to the rectum, but we know that they're inflammatory conditions. And so the most common ones are going to be Crohn's, which can be localized to the small intestine, which can also present in the large intestine, or it can be ulcerative colitis, which is large intestine. And with ulcerative colitis, they're ulcers that are presenting themselves in the colon. So that mucus layer has been damaged, and now the epithelial lining, the gut lining, presents with little ulcers on it. With Crohn's, we are seeing that there is that inflammation as well that generates pain, discomfort. And with ulcerative colitis, it can be microscopic as well. Sometimes patients initially aren't diagnosed if they just have a colonoscopy without biopsy taken. And upon taking biopsies, at least 6, sometimes the gastroenterologist will find that the patient has microscopic colitis that might have been initially missed in another colonoscopy without biopsy. So you always want to ask for both and really advocate for yourself. And what are some symptoms? So you might be saying, I have frequent diarrhea. Your body is just not tolerating substance in the GI tract and it's evacuating it very immediately. So if you have constant diarrhea, and again, in that diarrhea, you might see blood and mucus. Might not necessarily always be diarrhea, you can be constipated, but you're seeing very constant blood and mucus, and deep red blood is usually what's seen, but it can be bright red blood as well. You might be feeling very fatigued. We see that with IBS and IBD, nutrient deficiency is prevalent. We are reducing our absorptive capacity. We are reducing those brush border enzymes that are available. And so you might have nutrient deficiency. The bacteria that overgrow in IBS might be competing with your own body for digestion and absorption. And then with IBD, again, when the lining of your intestines is damaged, that might also alter your absorptive capacity. So you might be feeling very fatigued. Common deficiencies in IBD patients are vitamin D, B vitamins, and iron. You might be having constant abdominal pain and cramping, right? It hurts. It hurts to have that inflammation in your gut. It hurts to have that inflammation in your colon if that's where it's localized. You might also have unintended weight loss and reduced appetite. That constant inflammation is going to send those signals to your brain to say, I can't handle food, don't eat. Don't send anything down here. And you might lose weight again because you have less absorptive capacities. So if you're saying that that resonates with you and you're like, yeah, I've been really having blood in my stool, mucus in my stool very consistently, you really should talk to your care team about it and get a follow-up for IBD. And we know that with IBD, inflammatory bowel disease, diet does matter. Despite some saying it doesn't, we know certain inflammatory foods will exacerbate that inflammation that is already occurring. So we know the inflammation might come from diet. It can also be triggered by stress. Stress triggers more inflammation in our gut and in other areas. It might be genetic, it might be environmental, but we know that certain foods can be very triggering and very uncomfortable for those with IBD, especially when they're in a flare. So dairy is a big one, right? It's oftentimes high in saturated fat, even if it's low fat dairy, it can still be inflammatory. High fat foods, spicy foods, caffeine, alcohol, these can certainly exacerbate symptoms of IBD.
The pelvic floor PT, in addition to, again, talking to a lot of these main things, in terms of there's restrictions that are inhibiting your ability to stand with an appropriate posture, so you're not hunched over, allowing a space for your organs to kind of contract and relax as they need to. We can also talk about ways for better stress management, to deal with whatnot, whether that's movement related, finding comfortable, easy ways to move, as well as other strategies to manage your stress.
And as far as all these conditions, we kind of mentioned some of these dietary interventions. So I was sprinkling them in along the way, but I can't emphasize enough how important it is to focus on your root cause and try to heal that and tolerate more foods rather than just saying, I intuitively feel better when I don't eat a large amount of food, and it gives me a greater sense of control when I'm only eating 5 different things. So that's what I've been doing for 2 years. And I hear this from my patients constantly, that they're saying, I've been low FODMAP for years. I have been on an SCD diet, or I've been on this very limited diet because if I eat anything else, I don't tolerate it. That only leads to more issues, right? We're talking about nutrient deficiencies already. We can sometimes see lack of oral tolerance to foods with prolonged restrictive diets. So if you are finding yourself pigeonholed and seeing that I only tolerate a few types of food, you really do want to reach out to someone who can help you introduce and tolerate more foods rather than remain in this restrictive phase. You want to tolerate more of these anti-inflammatory foods. Again, you want to get to the root cause. You might need to start with low fiber or less fermentable foods. Maybe you are starting low FODMAP, so less fermentable carbohydrates. And then you're working your way up to not just a higher amount of them, but also more grams of fiber throughout the day. And like we mentioned, working with a care team who can teach you things. A simple trick that I teach my patients is, let's break down the fiber. Let's almost pre-digest the fiber before it makes its way into your body. So let's break apart that cellulose, those fibrous walls. You can do that by cooking, by freezing, right? When we thaw fruits and vegetables, they look sad and they have lost really a lot of that retention with the fiber. So freezing, those ice crystals break apart the fiber. We can blend fiber to help it become more digestible, or doing all 3 of them, right? Maybe in a smoothie, you are blanching your spinach, you're freezing your spinach, and then you're blending your spinach in your smoothie, because you might find raw spinach bothers you, but you can tolerate it this way. So let's try to add fiber in a very tactical way. So that way you don't feel stuck, you don't feel overwhelmed, and you are not causing more issues downstream.
So prostate enlargement, or sometimes it's called BPE or BPH, benign prostatic enlargement or benign prostatic hypertrophy. So this is what happens when the prostate gland enlarges. And as the prostate expands, this can constrict and obstruct the urethra, which then makes the bladder have to work harder. Then the bladder wall has to thicken, and then that makes it much more difficult to store more urine. So then in these instances, urinary urge, the threshold decreases, causing urinary frequency. And then when this happens, oftentimes the bladder cannot empty completely, which then can lead to urinary retention, or the inability to really fully void or empty our bladder. So then when there's residual urine in the bladder, this can often lead to infections or bladder stones, and potential kidney injury can occur from there. This is a very common condition. There's about 3 million cases in the US per year. Roughly 80% of men develop prostatic enlargement. So typical symptoms can be difficulty starting urinary flow or noticing a weaker stream. Like I said before, urinary urgency or frequency, pain with urination, pain waking up at night and feeling like you have to go to the bathroom, and even potentially straining or urinary leakage. And then in terms of prostatitis, this is a disease of the prostate where there's inflammation, and this can result in growing pain, painful urination, and then difficulty urinating as well. And this can be caused by bacterial infections or nerve damage, potentially from some sort of trauma or injury to the groin, or surgery potentially. And then all of this, like I said, leads to inflammation. And Dahlia can talk more about the inflammation and diet aspect of prostatic enlargement.
Yes, absolutely. So we are certainly also seeing, just like we're seeing with interstitial cystitis, IBD, IBS, inflammation, right? Inflammation is the buzzword of today, but a high inflammatory diet, a sedentary lifestyle, and inflammatory lifestyle as well, of some of those factors that we had mentioned in the beginning, can preclude and really cause one to be more at risk for prostatitis. So working on lowering cholesterol, working on lowering blood sugar, like we talked about, those can be inflammatory in and of themselves because they stress the body out. We know that adding more of these foods, adding more high nitric oxide foods as well. So foods that help with relaxation and widening of the blood vessels. So think of things that are very dark pigmented in color. So dark blues like blueberries, blackberries, dark reds, beets are amazing. One of the highest nitric oxide foods, pomegranates. So we really want to be adding in more of these foods that can help with vascularity, help with blood flow, and reducing inflammation. All right, and this is our last slide. So erectile dysfunction, Kat's going to talk to us a little bit about it, and then we'll talk about how diet plays into this.
So in regards to like the pelvic health side of things, I really do believe that there's a large dietary component to ED, which is why I'm so excited that Dahlia is talking about this, because oftentimes that's not talked about in the doctor's office. And this is a huge component of what people experience in terms of erectile dysfunction. But I think at the end of the day, a lot of it has to do with a vascularity issue and our ability to have appropriate blood flow through that area. So in physical therapy, that can look like, again, as we're working through and improving mobility surrounding the pelvis, whether that's hips, low back, the pelvic girdle itself, as we're working through areas that might be restricted, we are creating more blood flow to the area. They all play such a large role in each other. So those areas are so important to work through. And then also working through if there's any soft tissue restrictions on the penis itself. So sometimes there might be tissue tension or some sort of injury to the area or whatnot. And so just working directly on that tissue can be oftentimes beneficial for some individuals. And then again, pudendal nerve mobility. Pudendal nerve innervates our ability to kind of contract and relax our anal sphincter, as well as our urethral sphincters, which helps with our ability to pee and poop. And then also that sensory innervation to the perineal area, the penis, scrotum, our labia, and our clitoris. So that nerve is super important in terms of pelvic mobility and function. So I'll have Dahlia talk about the diet aspect of erectile dysfunction.
Yes. Again, inflammation. So oftentimes erectile dysfunction is thought of as the canary in the coal mine of cardiovascular disease risk. Sometimes men are diagnosed with erectile dysfunction prior to finding and unearthing that they might have hyperlipidemia, high cholesterol, right? And anything really that is going to decrease blood flow to an organ, whether there is more lipids, more fat in the blood, there are more lipids, more fats in the blood, that can certainly affect blood flow. And especially in areas of the body that have smaller nerves and smaller vascularity. So cholesterol can cause a change in blood flow. We know also that diabetes can do the same. And oftentimes when your hemoglobin A1C, that measure of the percentage of sugar that's averaging in your blood for 3 months, when that is higher, you have thicker blood. It's a little bit stickier and it's not going to freely flow and oxygenate these areas with smaller nerves. So certainly bringing down blood sugar, bringing down cholesterol, and really focusing on those anti-inflammatory foods that we've been talking about can be very, very helpful with so many conditions. Our body is so incredible. It's so great at telling us when something is off. If we trust it and really listen to it and really try to find interventions for that, our body is so apt to healing, and we just need to link up with the right people to help that.
So next up, so we just threw a lot of information at you, I know, but in terms of what some of us might be sitting here thinking, oh, like, oh, I have these symptoms, or I know I have this diagnosis. What do I do with this now? And how you can implement this information in your everyday life. So things like thinking about the types of food that you're putting in your body, thinking about a lot of the information Dahlia talked about what are we adding? Are we eating enough anti-inflammatory type foods as part of our everyday diet? And then looking at the lifestyle interventions or modifications that we also talked about, whether that's sleep, movement, stress management, chemicals that we have around our life, our house, different things like that. And then assessing where you can reduce other, areas that you might notice you have higher inflammation, whether that's dietary or lifestyle habits, and making small changes there. And then just taking some time to also see, does any of this information that we've talked about today, does that resonate with you? Do you notice, can you identify with some of the symptoms that we talked about, or the things that you're experiencing in your body? And if so, reach out to a professional if you feel like you might benefit. And here's our contact information, both Dahlia and her team at Married to Health, and then myself, and then our team over here at IPA Physio Orange County.
Absolutely. And we'll go ahead, and if anybody has questions, we'll answer them. You can use the chat function. I see someone's asking a question. Do you see folks virtually, and do you accept insurance? My practice is 100% virtual. So we do see patients throughout the country and internationally as well. And if someone has benefits to see a dietitian, then we can bill to insurance in our practice. And Kat, do you see people virtually?
So we do have the option of seeing people virtually. It is an option that we offer to people. Most of our clients do come in person in the clinic. Just with the nature of, I think, our types of treatment that we do, we're very hands-on at our clinic. So we love to be able to treat people and provide help in person. But in regards to a lot of some of the pelvic health type issues, we do have that option of seeing people virtually.
Perfect. All right. And we'll answer some of these questions. If they are very specific to your medical care, I suggest contacting us personally or working with your care team. We can't necessarily answer very, very personal questions, but general questions we can give some insight to. So one thing that was asked, how often have you seen red flags that lead you to think of cancer? Once we've really done a lot of work and understanding and really controlling inflammation elsewhere and getting gut health under control, it's quite rare. So if you suspect that, you certainly want to bring it up with your care team, bring it up with your primary provider first and foremost, because they can help you run appropriate labs. And that way you are able to get a diagnosis. What about you, Kat? I don't know if you've had different experience.
So that's something in terms of red flags that we're always screening for within our subjective. Day one eval, we're looking for those things to make sure that we're not seeing anything that might be suspicious or something that's out of our scope of practice that we feel like, maybe we're not the best person for you in your care at this time. If as we're going through treatment and someone's not getting the results, or something just doesn't quite feel like they're appropriate, or it's more musculoskeletal related, then it's time we know to send someone back to their doctor for further assessment and evaluation.
Mm-hmm. Okay. And we had someone saying, great comment, in terms of efficient elimination, I think the squatty potty is a game changer. And Kat had mentioned that posture really does matter in the restroom, and a squatty potty can certainly help with that. So definitely. Any tips for dealing with recurrent UTI? Work on your microbiome. We know that microbiome dysfunction, dysbiosis, is going to increase your risk for UTIs. So work on that. You might consider other general things like anti-inflammatory diet and I oftentimes will recommend D-mannose for my patients because it is a simple sugar that can prevent E. coli bacteria from adhering to the bladder wall. So sometimes regularly supplementing with D-mannose, cranberry, certain things like that. But really working on gut health can help stop them so that way they don't recur. And a couple more, we'll answer just a couple more because I know we went over. How often have you noticed that falls and trauma have led to bowel and bladder issues and that the visceral mobilizations are effective? That's certainly a cat question.
Yes. I am so glad that you asked this question because so often have I seen that. I always ask someone, is there any experience of trauma to the pelvis? Have you ever fallen on your tailbone or anywhere on your pelvis? Because this has such a profound effect on the pelvis's ability to move, whether at the sacrum and nominates muscles. This can create adhesions of the organs to the pelvis. I've seen a number of patients that have history of falls and working through the viscera and getting that to free up when it's so bound down with either scar tissue or it hasn't healed appropriately, has made tremendous effects for so many people that I worked with. And that could be things like people who are having pain with intercourse or pain with menstruation. They might have had a fall when they were a teen or younger as a child and, didn't notice anything then, but, years later, they're having symptoms. Or issues and they don't really understand why. So I would say that this is something that is happening quite frequently. And I see there are great benefits to visceral mobilization because of this.
Love this. Someone is asking, what are your top probiotic foods that you recommend, like onions? Onions are a great prebiotic. Prebiotics are food for probiotic species, and probiotic means it supports the growth of life and bacteria. So certainly you want to get in enough food for your bacteria that are already there, eating tons of fiber, prebiotic foods. As far as probiotics go, a really great study actually just came out and it showed that higher consumption in the study, people consume 6 servings of probiotic foods per day. You don't need to go to that level, but higher consumption and fermented foods increased microbiome diversity and decreased inflammatory markers. So some of those might be things like miso. I'm a big fan of miso, and you don't want to heat these things up too much because if you heat them over about 115 degrees, it denatures the probiotic, but miso is great. You can do something like a dairy-free yogurt that's unsweetened, a dairy-free kefir. You can do sauerkraut, kimchi, any of these fermented and pickled foods as well. So those can be great things. If these make you feel worse, you want to try to figure out why. It might be histamines, might be bacterial overgrowth. Last question that we have. How often have you seen reversible gastroparesis? In the case, in the setting was in a lung resection and some other chain of events causing much increased coughing and a small hiatal hernia. So sometimes when you see gastroparesis or immobility of the intestines, it can be immediately following a trauma or a surgery. That's called ileus. Usually this resolves within a couple of days to weeks. If it's chronic and ongoing, it could be considered gastroparesis, where you are just having extremely slow motility. Sometimes we see this in the setting of also uncontrolled or brittle diabetes. But with gastroparesis, I have seen it reverse if you're working on the root cause and you are trying to decrease inflammation in the gut, other stressors, whether they're peripheral stressors in your lifestyle induced stressors as well. So mental and emotional stress, again, that chemical stress, that physical stress, working on that, and then working on balancing the microbes in your gut. Maybe even working with a physical therapist can be helpful with gastroparesis as well, because it helps with that vagus nerve stimulation, that nerve that really runs through our entire gastrointestinal tract. So those are my suggestions.
Great. All right. Again, thank you everyone so much for attending. We're so glad that you chose to spend your evening with us. So if you have any questions further, feel free. All of our information is on here. yeah, our recording will be up on YouTube tomorrow. So feel free to share that with everyone that you would like to share that with. Yeah, thanks. And I hope everyone has a good night.
Yes, absolutely. And for Married to Health, you can subscribe. If you go to our website, you can subscribe to our newsletter and receive updates of when we're going live. We go live every other Friday and talk all things gut. And yeah, the video, like Kat mentioned, will be on both of our YouTubes. So thank you everyone so much. Great questions. Have a great night.